Number one leading cause of kidney disease is diabetes. 40 to 45% of the causes of chronic kidney failure is diabetes. Now, there are several tests you can do to actually see how you're doing in terms of blood sugars. You have an OGTT, the oral glucose tolerance test. You can do a random glucose test or random blood sugar test. You can do a fasted blood sugars. But the most important one when you're trying to ascertain these problems is a HbA1c. So diabetes. And how does diabetes cause? Now we can go back to our diagram, right? How does diabetes cause a kidney problem? Now, HbA1c is a test that measures how much glucose is attached to proteins. And the major protein here is the hemoglobin. So HbA1c is called a glycation test. So basically it measures how much sugar in form of glucose is attached to your red blood cells. And sugar is a very sticky substance, you know very well. So when it attaches these red blood cells, it makes them become very sticky and very sluggish. And now they start settling on blood vessel walls. But on the kidneys, because we have the larger blood vessel coming in, the afferent arteriole, it's larger and wider and brings blood into the kidneys, into the glomerulus. This is the glomerulus and this is the Bowman's capsule. So this one is a larger one, the afferent arteriole. Now, because it's larger, these deposits of sugar cannot stick here so fast. So it takes a lot of time before they stick on the larger blood vessels. However, as these sugars and these proteins that are attached to sugars, it's called glycation, non-enzymatic glycation. As they are sticking to these sugars, they are pumped through this, they go through the filter, and when they come to the narrow one, the afferent arteriole, the E, when they come to this one here, they now stick there because this one is narrow and the blood pressure now is actually regulated because after the filtration, at least we have a slower blood pressure a little bit. Okay, so now here, because it's narrow, they start sticking here. Do you see the orange part? People on TikTok, do you see the orange part or the red part? That red part, I hope you can see that. Yes, that red part, all this red that I've just shown here, this is inflammation. So number one, sugar will cause inflammation of the glomerulus and a part of the Bowman's capsule. And then sugar deposits will deposit in the efferent arteriole, the one that is carrying blood out of the kidneys. And when they do that, they start forming inflammation in these blood vessels. And that inflammation is going to cause thickening and hardening of these blood vessels of the efferent arteriole. When that happens, now we're forming these plaques here and here. And this blood vessel now starts to narrow and becomes thicker and narrow and more hard. It's not flexible. So it does not accommodate the changes in blood pressure. Now we have blood pressure building backwards in the glomerulus and in the afferent arteriole. So kwenda mbele, blood pressure is okay. But coming back into the glomerulus and back into the afferent arteriole, there is an increase in blood pressure. Now that blood pressure, number one, sugar caused inflammation of the blood vessel and then narrowed and blood pressure increased. But now we have another blood pressure that is building backwards. And that pressure that is building backwards will now exert a lot of pressure on that sieve. And this sieve can end up rupturing, or the holes or the pores in the sieve start opening up because of increased blood pressure. And now we start filtering even the proteins that are not supposed to be filtered through the kidneys. That's how we end up getting proteinuria. That's how we end up filtering glucose and we get glucosuria. In urine, there's glucose. In urine, there's now albumin. And now, on the other side, we have building blood pressure in the arteries. And that's how sugar destroys your kidneys and starts causing you hypertension. Number two, kidneys regulate blood pressure. When you have low blood pressure, there is that RAS system, the renin, aldosterone, angiotensin system. So when blood pressure goes down, the kidneys reabsorb sodium, they reabsorb water, your blood volume goes up, your blood pressure goes up. When the blood pressure is super high, the kidneys excrete sodium, water follows, and now blood pressure goes down. That is how the kidneys regulate blood pressure. But now you don't have this mechanism to regulate blood pressure. You don't have these kidneys that is functional enough to regulate blood pressure. What is going to happen? You're going to build up blood pressure. You're going to retain fluid because you cannot excrete excess fluid. And now you start having edema, you start having building blood pressure in even the veins and the arterioles. That's how blood pressure comes in as a result of kidney failure. So now you've built up blood pressure, you've destroyed the kidney structures, and now you're filtering all the components that are not even supposed to be filtered in blood or in urine. Now you're getting all this protein in urine, you're getting all this glucose in urine, and now there's a problem. When you see that urinalysis test, of course, you're now confirmed to have a problem. So now you've seen there is inflammation in the glomerulus and in the efferent arteriole. But I want you to see this. This inflammation, when it's happening in that Bowman's capsule or in that glomerulus, that sieve of ours, we call that glomerular sclerosis. Glomerular sclerosis. Sclerosis means hardening and forming fibrous tissue, which is basically scarring. But glomerular means the glomerulus. So when the glomerulus is actually forming these scars, and now you're actually affecting the process of filtration, because you see, when you're forming this inflammation here, you're actually blocking this filtration process. Therefore, you are altering it. And now the filtration rate goes down. Therefore, the GFR is low. And that's why at stage 5, you have below 15 ml per minute, because the amount of fluid that is being filtered is now reducing. Okay? So now pressure is building the other side. And even the volume of urine is now reducing. So once you've understood that, let me take you through this. So we have an increased glomerular sclerosis, and that is coming in as a result of inflammation. And where are we getting inflammation from? At this moment in time, you already start to notice that the treatment is coming in handy. So where do you think we are getting inflammation from? What are the foods that we always constantly sing that are actually highly inflammatory to the system? The foods that I constantly tell you, avoid these foods because they are inflammatory. And now they cause inflammation to these glomerulus. Now they cause hardening and thickening of blood vessels. They also cause scarring of the glomerulus. And now filtering blood and filtering fluids starts becoming a problem. So from here, when you have now this increased glomerulosclerosis, the next thing that is going to happen is you start destroying the nephrons. Remember, the structure that I've just shown you is actually a cell of the kidney. It's called the nephron. So when you start affecting the glomerulus, the filtration rate, the next thing that is happening is you're now destroying the cells of the kidneys. And this takes you time. Remember, there are millions in one kidney. And you have 2 kidneys, so you have a lot of them. So by the time you've destroyed these cells, you really worked so hard for it. You really did. You played a role. My friend, you ate sugar, like literally. Because the body is always trying to favor you. Anytime you create an imbalance, the body brings back the balance. You create an imbalance, the body brings back the balance, sorry. Until a level where the body is now tired and tells you, wewe pia nawe, kaa. Alcohol, sweet products, seed oils, sugar in all forms, including fruits and honey. Those are the things that cause insulin resistance, and they cause scarring and inflammation of the glomeruli. So now you destroy the kidney cells. So you start with inflammation. This inflammation starts to destroy kidney cells. When you destroy kidney cells, you start filtering proteins and sugar in urine, and that is CKD. Because the number 1 indicator that you're actually having a problem with the kidney and it's chronic is albumin in urine. That is protein in urine. Nani hajaelewa mpaka hapo? People who are suffering from kidney disease. I know you've read a lot of research, you've done all these things to just make sure that you get a slight chance of information to help you recover from that kidney disease. Those of you who are not yet there, and sometimes you experience recurrent yeast infection or diseases, you experience a lot of urinary tract infections, you have anemia most of the times, you end up having very bad skin, okay? You have this round face that is accumulating fluid, you have edema when you travel. These are the people that I'm appealing to right now. For you to protect yourself from going and deteriorating to this level, it's time for you to actually start listening. Don't wait until you get to the worst for you to start asking me, doc, how do we treat kidney disease? There are people who are there already, and they are wishing they had a kidney like yours. And you, at that moment in time, you're seated there telling me, mwili mpya tutapewa mbinguni. And you're making even jokes and saying, you know what, I want to donate the kidney. And I want you to see, guys, during the World's Kidney Day, the World's Diabetes Day in Kenya, the Ministry of Health organizes these ceremonies, And the big pharma has banners and placards all over, marketing themselves, marketing the kidney medication, marketing new technologies for kidney transplant, marketing new technologies for dialysis. And the nephrologists are there, the urologists are there, giving different speeches, but nobody is talking about food and diets. And then at the end of that, they've talked, they have yapped, they have told you all those speeches that are so tiring, they don't make sense. The same urologists, the same diabetologists, the same nephrologists are obese. But they're giving you speeches because they have a title and the ego is there. Oh, you know, I have a MDHD, MBA, whatever, and PhD, HK, I don't care. Telling you about how they went to UK to study new technologies to boost the kidney disease and kidney function, to bring in new technologies and incorporate them in dialysis. I'm looking at them, I'm like, oh, okay, tell me more. Then look at the same fat doctors. After they've given those fake speeches, they've regurgitated the syllabus to you. The next thing they're doing is they are cutting a cake. And on top of that cake, is well designed. On top of that cake, it has a kidney. So they sat down and decided, we will take a cake from somebody's cakes and pastries. And now they've made a cake. And that cake, on top of the cake, they put a kidney. Oh, we celebrated World Kidney Day by cutting a cake that had a kidney on top of it. Yeah. Hey. At the World Kidney Day, World Diabetes Day. And then they tell us, oh, you know what? That is not a big deal. That was just one day cake. What message are you passing? What message are you passing to the general public? That it's okay to eat a cake even if I have a kidney problem? And they put a cake there. They know you have insulin resistance. You cannot resist a cake. A cake is there. By the time they're giving all these speeches, your mind is on and off. You're just thinking about the cake. What time will they cut the cake? So they can take a piece and enjoy it. I mean, we will all die. I want you to be very careful. And you see the backgrounds of this. The ones who actually sponsored this, they will actually acknowledge the ones who sponsored it. Oh, this is sponsored by this big pharma, courtesy of big pharma. This is sponsored by that company that produces insulin therapy. This is sponsored by whatever company. It doesn't matter. And remember, diabetes treatment guidelines are sponsored by the big pharma. Go and read the acknowledgement sector. You'll see. So the same big pharma is putting their placards there at the back because now you have a kidney disease. They're putting technologies there. They're putting the injections there. They're marketing their products and medication for kidney disease. And these medications are not going to treat kidney disease. They are going to mask the symptoms of kidney disease. And then, of course, as you develop the kidney disease and failure slowly and carefully, you move from stage 3A, 3B, and now at 4. By the time you're realizing they're telling you need a kidney transplant, that is stage 5. And that urologist and that nephrologist tells you that before I perform this thing, you must put $500,000 on the table for my deposit. We've not even found the kidney, daktari. Hatujapata the kidney. And I have to find $500,000 before I even find the kidney. Why, daktari? We've not even talked about the diet. So he tells you, go, no problem. About diet, you continue eating what you've been eating. There's no problem. Just eat. You will come back. So you have a month. Go talk to your people. You have a month for the surgery, to prepare for the surgery. Just go and find the money. But make sure $500,000 is mine, is put aside for deposit in my account. Then we can talk about where we can do the surgery from. We can talk about you finding a new kidney. Hello? No, my son. Eh? You know, you guys, maybe you've never experienced these conditions. Some of us, our own people, have experienced these things and they have drained us so bad. And not, if it was not for the identity thing, we will be very bitter with the systems. If it was not for the identity, I did not start Identity Fridays for no good reason. Some of us have been drained, like literally. You sleep with maybe 5,000 in an account. You wake up tomorrow, you wake up on a WhatsApp group. This 5,000 is already gone again. Hey, I thought we did a surgery. Oh no, there's a complication. It's going for another surgery. Please, 5,000. Now pop again, another 5,000. Hi. Well, sawa tu. Anyway, let me read some questions here. Deceptive marketing at its best. They market everything. Everything. So now look, For you to destroy the kidneys, one, you must have inflammation. That is sugar, okay? And number two, you must have reduced blood flow towards the kidneys. I told you sugar clogs the arteries that supply the heart, the brain, and the kidneys. When you clog those arteries, now blood flow towards the kidneys is actually limited. Now remember, the kidneys have a function to filter blood, so blood must come into the kidneys. If blood is not coming in, we don't have any filtration process. The kidneys start to shut down. And now the same kidneys that are shutting down because there's no enough blood coming in for filtration are actually being affected by inflammation and sugar deposits in the vessels, in the glomerulus. So you're just a walking dead. Okay, so sugar is dangerous. Sugar, wheat, seed oils. And when I say sugar, I mean sugar in all forms. When you eat that brown ugali and you're having a kidney problem, simply know you're eating sugar. Your body does not understand brown ugali. Your body does not know brown chapati. Your body knows glucose. And glucose is causing insulin resistance, which is causing kidney problems, which is causing inflammation. So therefore, somebody who has a kidney problem, sugar is a no. No carbohydrates, literally. Don't ask me where you'll get energy from. You are diabetic, for heaven's sake. You are diabetic. Today I'll use that. You've been diagnosed with diabetes. That tells you have a lot of glucose in the system. So what is energy according to you? Is it not glucose? So why are you on sugar? Why are you on honey? Why do you want to sit on food when you have a sweet problem? So the major causes, and I'm not going to other, I think I should just read out the causes for you to know. So that was diabetes. That is the major cause. Number two, hypertension. Of course, an increase in blood pressure in the glomerulus ruptures the kidney cells, and now you have kidney problems. Number three, we have glomerulonephritis. Glomerular nephritis. Nephritis, destruction of the nephrons or inflammation of the nephrons. This is basically inflammation and toxins and all that. Number four, obstructive kidney disease. These are just other causes, but I'll focus on three of them. That is diabetic kidney failure, and I'll focus on hypertensive kidney failure and glomerulonephritis. So those three. But now the others, of course, kidney stones are there. Under the obstructive kidney disease, we have kidney stones, and this is calcium oxalate. You'll be told to avoid spinach, but you're not told to avoid sugar. You're not told to avoid things that actually cause you the oxalic acid that reacts with the calcium to form calcium oxalates. That is sugar. Now, we also have an enlarged prostate. When you have an enlarged prostate, you're actually pressing against the kidneys. You're bringing in problems and obstruction. We have tumors, the cancers. So all those are classified under the obstructive kidney disease. They obstruct the kidneys, you retain the fluids, you retain the urine, you retain toxins, you start causing kidney failure. And then we have recurrent and repeated kidney disease infections and urinary tract infections. And then we have prolonged use of medicines. On these medicines, allow me to talk about this. Ladies, as you use the NSAIDs, diclofenac, meloxicam, aceclofenac, celecoxib, as you use NSAID to kill your menstrual pain and use them every single month, remember, we talked about NSAIDs and kidney problems. So NSAIDs, they reduce the patency of blood vessels that supply the kidneys. When they reduce that patency, blood flow towards the kidneys is now limited. You start killing the kidneys. So as you use those NSAIDs are supposed to be used for a short period of time, 2-3 days, you're good to go. People who have arthritis and you're constantly swallowing meloxicam or aceclofenac or diclofenac, oh, you know, when I take this, I'm okay. When I take this, I'm okay. You're actually going to destroy your kidneys. Drugs like steroids and the steroidal anti-inflammatory drugs, the hydrocortisone, the dexamethasone. Ladies, as you use that dexamethasone to enlarge your hip and your face and impress the man because you're now having this fat round face. It's called the moon face. You're causing yourself problems with the kidneys, water fluid retention, electrolyte retention. That is actually a side effect of kidney disease. You are not having a round face. You have a kidney problem. You're not having a big hip. You have a kidney problem. And that's the reason why you end up having very weak bones and you can easily stumble and get the fractures. So ladies, if you're not born light skin, you are dark, accept it and move. Fix the identity. See you on Friday. See you on Friday. Now, other things. So NSAIDs, antibiotics like vancomycin, like gentamicin, streptomycin. Some of you go to hospital and you're diagnosed with a fake disease called brucellosis. Instead of fixing the gut to help you protect you from this brucellosis, you go to hospital and after the diagnosis, And I told you, brucellosis, Widal tests, the Brucella test, the Widal test, and the H. pylori test. These are tests that actually can turn positive anytime. So if I want to exploit a lot of money from you, I can easily do those 3 tests or those 4 tests, and I'm good to go. I will add on a malaria test to just convince you, okay, kumbe one can turn negative, the rest are positive. And now you are put on gentamicin, maybe 160 milligrams or even 80 milligrams for 21 days. What? We kill our people without even thinking twice. And then their ears start ringing. Masikio zao zinapiga nduru. Their ears are ringing because you're destroying the nerves that supply the ear because of these macrolide antibiotics. So gentamicin is the one that is most commonly abused, and streptomycin. So you inject streptomycin for 21 days. And then after 1 week you go back, Brucella is still turning positive. Why? Because you don't fix the gut. You keep fixing the symptoms of a messed up gut. So you're taking streptomycin and gentamicin 21 days. Are you serious? How do you even manage to take these injections for all that time? 21 days. Hey, nyi pia basi mkona gluteus maxima. Yeah. So drugs like NSAIDs, drugs like reserve antibiotics, drugs like anti-cancer drugs, drugs for TB. These are drugs that you should take with a lot of cautions, and that's why you should boost your immunity so that you never suffer from these conditions, so that you avoid those antibiotics. Okay. And then other conditions like lupus. Lupus destroys your kidneys. It targets every single tissue and organ in your system. So SLE, systemic lupus erythematosus, is one of the diseases that is an autoimmune that actually destroys your own system. And then, of course, toxins. On the toxins, GMO is there because of glyphosate. Skin products and skin lightening products that come with heavy metals like mercury, like lead. The fluoride in your toothpaste, the commercial toothpaste that you're told this will whiten your teeth. Fluoride is crazy. Industrial chemicals, aflatoxins. When you put your maize in a store for the longest period of time and this gets attacked with the fungal, and now that is aflatoxin, destroys the kidneys literally. So therefore, skin products, even the motor vehicle chemicals nowadays. Petroleum products, be very careful when you're trying to do these things. Those people who inhale petrol to just get high. Kweni wajanja.